This is Edge Perspectives, a weekly conversation about the biggest insights that span healthcare market intelligence, quality, and operations with the Vizient Strategy Intelligence team and other experts.
We expect to see in many markets across the United States fewer pediatric populations. This will vary by market, but there's a little bit more to it. 23% decline in fertility rate and a 16% decline in annual total births since 2007. We've had less organic growth in terms of demand for pediatric services across the country.
Hello, and welcome to Edge Perspectives. I'm your host, Tori Richie. Today, I am joined by Madeleine McDowell, a senior leader on the Vizient Strategy Intelligence team. She leads our research analytics team, and we are going to talk all things pediatrics, reflecting on the Children's Landscape panel that Maddie led during the recent Vizient Executive Strategy Summit. Maddie, thank you so much for being here with me today.
Thank you, Tori. It's a pleasure to be here.
Diving into recent data trends, what recent historical utilization data is showing for the pediatric population?
What we have seen is a flattening in overall inpatient volumes for pediatrics, but in the most recent year of data, so comparing 2025 to 24, we saw a 1% decline in pediatric inpatient, a 2% decline in normal newborn, and a 2% decline in ED. Part of what's driving some of this decline is infectious disease volumes. Last year was a mild flu season. And over the last 3 years, we've seen the impact of the introduction of the RSV vaccines have an impact on admissions and ED visits for bronchiolitis. Our most recent data shows that for the last 3 winter seasons, we've seen RSV admissions, bronchiolitis admissions, decline 27%. This is significantly driving it. We've also seen the birth rate decline as well as outpatient shift further impacting inpatient volumes, surgery and orthopedics declining. And then we have some service lines that have been growing. Behavioral health, which grew in the last year for inpatient admissions by 7%. This is probably more to do with the supply of inpatient beds. More and more children's hospitals have invested, and this has taken some time, but since COVID, they've invested in psychiatric beds, which are now coming online. Rather than we've had a behavioral health crisis in peds, we've had increased demand for services. We believe that this is more matching that need. We're able now to care for those higher acuity patients in inpatient settings more often. Less of an increase and more of a meeting demand through an increase in supply. We also saw a rise in cardiovascular admissions in the last year. Some of this has to do with transplant and new current protocols around arrhythmia. And then neonatology also growing, which is interesting because normal newborn and birth rate have been declining year over year. And over the last couple of decades, we've seen neonatology volumes increase. The percent of babies born requiring neonatal services is increasing. While we're seeing a flat to declining demand for inpatient and ED, we're also seeing rising acuity in the form of behavioral health, CV, neonatology.
And do you have any thoughts on why perhaps we're seeing those conflicting trends, why we're seeing a rise in patient acuity amidst things like declining birth rate, which in theory should yield lower utilization, but that just isn't necessarily what's playing out in these high acuity settings?
It's very similar to the adult ward where we are seeing rises in chronic disease. When we look at neonatology, we see that women of childbearing age have an increasing rate of a host of chronic diseases, including high blood pressure, diabetes, increased behavioral health, and mental health issues. So all of this can put pressure on the pregnancy and result in increase in preterm births, increase in gestational diabetes, and other factors. Access is also challenging. We are seeing an increase in the closures of OB units, particularly in rural areas, as well as pediatric units and subspecialty care in outlying areas beyond children's hospitals' reach. So access is a real issue in terms of getting care early. Both of those trends are leading to rising acuity.
I imagine that we're starting to see the disruption of referral patterns and those more complex patients then have to travel further, which then allows there to be a greater gap in the amount of time before they're able to receive the care that they need.
Exactly.
I want to dig a bit deeper into the birth rate decline discussion. You set up this topic nicely. Birth rates and fertility continue to decline throughout most of the country. How should pediatric leaders be thinking about what these demographic trends mean for future pediatric healthcare demand?
The short answer is that we expect to see in many markets across the United States fewer pediatric populations. This will vary by market, but there's a little bit more to it. I'd like to give a little context. The birth rate has been declining since 2007, 23% decline in fertility rate and a 16% decline in annual total births since 2007. We've had less organic growth in terms of demand for pediatric services across the country. This does vary by state, and we did an analysis that looked at the baseline birth rate in each state in 2024. And we also looked at the percent change in birth rate, the decline in birth rate for most states post-COVID. So from 2020 to 24, we gave a score for each state to combine to see what their projections would look like for birth rate decline going forward. What we found was that in the 4 quartiles, we had declining birth rates to the lowest, the very low, the low. And then for the highest growing quartile, we had essentially flat birth rates. This is a trend that is impacting pretty globally the United States. There will be markets in Tennessee, for example, in South Dakota, where we'll see higher birth rates. They had a 1% increase in birth rate in the last 4 years, so not significantly higher, but their birth rate baseline is higher. We have states like Vermont, District of Columbia, that are significantly lower baseline birth rates, and their percent change in birth rate was pretty significant, minus 13% decline post-COVID for District of Columbia. When we think of this, children's hospitals have also seen some increased demand because of the birth rate decline. And we've seen closures ongoing of pediatric units across the country, as well as OB units. What this means is that patients are traveling farther for their care. There's delays in that care. And children's hospitals are seeing pockets in their outlying markets where they are being more and more responsible for the care of these patients. In some instances, children's hospitals are seeing this higher acuity patient population from farther away regions at the same time that the overall pediatric population may be declining.
And to that end, do you have any guideposts or thoughts on how organizations should adjust their long-term planning, given the sense that no matter the market that you're in, even if you are experiencing a slightly positive birth rate or you're not declining as steeply as the national, there really isn't a tailwind for pediatric growth? How do we ensure that we remain solvent? How do we ensure that we help fill those access gaps for folks if we do start to see the closure of sites of care?
We did speak about this on the panel, and there were some really interesting insights on this. First of all, we don't see this changing. There's a lot of other additional trends that will likely continue to suppress birth rates, including the immigration trends, the cost of living trends. All of those seem to be worsening in terms of family planning and larger family sizes. What we do see, though, is that children's hospitals tend to have some advantages here in terms of growth. And that is one thing we talked about in the panel was how many children's hospitals have a wait list for their subspecialty visits. Pretty much everyone in the room raised their hand. What we're seeing is an opportunity to decrease the waitlist time, to increase access, to increase volumes. And this is not just for visits, but it's also for the downstream care associated with that visit, maybe diagnostic imaging or a procedure. The second thing is the larger geographic regions that children's hospitals will be responsible for as we see this consolidation in pediatric care at these large regional hubs. The ability to be able to provide that care more easily to these communities is really important to think about. One of the ways that we've seen children's hospitals do this very well is through telemedicine and digital solutions that help decrease the travel time for patients or for doctors as well, and increase the frequency of being able to see patients with chronic diseases on a more regular basis. Deploying those types of solutions in new regions is going to be top of mind for children's hospitals. Looking at their exact numbers, seeing what their birth rate trends are, what their baseline birth rates are in their different communities is going to be more important than ever in terms of planning.
Really taking that data-driven approach to understanding exactly what is the composition of the population and demand within your market, and how do you ensure that you're building out the proper access channels to meet that need.
It could vary within submarkets, and it's important to understand where your clinics need to be, where your urgent cares need to be. If you need to bring some subspecialty care to different areas, and a data-driven approach at that submarket level.
Fantastic. I'm going to shift us a bit to the theme of prevention and public trust. Could you speak to the ways that recent changes to vaccination recommendations are influencing families, providers, and then as a result, children's hospitals overall?
We've seen vaccine hesitancy increase over time, even before COVID. COVID, though, was definitely a turning point when we saw significant concerns around the COVID vaccine itself, which spilled over to other vaccines. This is not something new, but in January of this year, the CDC recommended that childhood vaccines that were previously recommended for all children, that 6 of them moved to this category called shared clinical decision-making, meaning they were optional. Right now, the vaccine schedule has not changed. But what this has done is sowed confusion and uncertainty in an area that was already confusing for many families and patients. And in a broader sense, we've seen this distrust of science and distrust of traditional medical institutions increase over time as well. An example of this spilling over to other areas besides vaccines is the vitamin K injections for newborns. Now, this is a very important injection for newborns that is needed because newborns have a deficiency in vitamin K when they're born, which supports your coagulation factors and prevents bleeding. We're seeing more parents refuse to give this injection, it's not a vaccine, to their newborns, and it puts their infant at an 80-fold higher risk of a severe bleed. And we're talking about things like brain bleed. So we've seen an increase in those complications as a result of this. A recent study was published that showed while the refusal rates are low, they've almost doubled in the last couple of years. That just suggests a lot of distrust for traditional standard of care. It makes it difficult for providers to get ahead of this, to educate the community around conspiracy theories they may not even know exist until the patient comes in the room and tells them about it. It also requires a lot of time. Time is important for building trust. What we talked about on the panel was that children's hospitals, first and foremost, really need to support their providers on the front line, their doctors and nurses, so that they have both the tools and resources to be able to educate families. There's a lot of misinformation out there, and to be able to provide the facts, if they're written or even speaking bullet points, is really helpful for those providers, as well as understanding that productivity models where they're expected to see patients every 10 minutes is going to have an adverse impact in terms of building trust. And in the long term, may really impact patient loyalty to your organization, trust. Not only are patients not refusing standard of care, but they're also seeking care from alternative care providers, as well as through information on social media. And so this is something that has a lasting impact on hospitals' overall ability to care for patients across care continuum and across their lifespan. We talked a lot about that on the panel and the importance of building trust. Now, children's hospitals, when we do look at surveys, they do have the benefit of having increased scores when it comes to trust and positive viewpoints on their abilities and services. They should not take that for granted going forward.
Thinking about some of the barriers to success that providers are experiencing in this environment, the proliferation of that productivity model in some ways stands in conflict with this idea of ensuring that we're meeting patients where they are, that we're opening up the type of access that they need. Do we think that we're going to start to see a shift away from some of these traditional models to something more value-based care, just because I'm lacking the other language to describe it, so that we're able to really be that comprehensive decision-making partner for families as they are thinking through the various healthcare needs of their children?
I hadn't thought of it in those terms before, but there will be market pressures to do that. We're already seeing that primarily on the adult side with concierge medicine. A lot of the commercial payer patients that are in a certain financial bracket are going to concierge doctors where they can get that time and leaving the traditional providers. The market could help enforce that. But the other thing is like the reality of the fee-for-service payment world is in direct conflict with that. And you mentioned value-based care. Those types of models we see on the edges and periphery gradually sometimes taking hold. And certainly that type of payment could really support having longer visits, more productive visits where we're really focusing on the health of the patient rather than just a transactional visit trying to get them in and out as quickly as possible. One of the other areas are these new CPT codes that are now out for providers to be able to bill for the time spent with a patient, even if a vaccine wasn't given. So the amount of time to be able to educate them, even if the patient decides in the end not to get the vaccine, this used to not be able to be billed for. Their study was just done that showed that pediatricians felt very positive about these codes. It made them feel that their time was valued. They felt acknowledged. And even if they don't get reimbursed, because many of these commercial payers are not reimbursing these codes, the fact that they had a code that they could bill boosted their engagement and satisfaction in terms of their work. There are some fee-for-service strategies out there too, but where I think we'll see more of an impact is in an alternative care model like concierge medicine or in value-based care.
It seems obvious in many ways. If part of what is sowing mistrust or distrust in communities is this idea of it's hard for me to access my provider, the turnaround time is really difficult, I can just turn to Dr. Google or a subreddit and receive the information that I think I need in order to make an informed decision. I'm going to use like air quotes there. If we don't start thinking about how we fill those gaps and we start showing up for our communities, I don't really know how we get ahead of this issue of lacking trust in the medical community.
That's a really important point for children's hospitals to be paying attention to. More people are turning towards AI and ChatGPT for their medical questions. At our Strategy Executive Summit, they talked about how a high percentage of those patients that use ChatGPT, it was something like 75%, never seek a doctor's service afterwards. They may or may not be getting the correct information, but they are getting their needs addressed through other ways. Those market pressures will have to be considered in new models that focus on meeting the patient's needs, getting them seen when they need to be seen, taking the time to build that trust with them.
All right, zooming out a bit, if we look ahead 5 years, what trend do you expect is going to have the biggest impact on children's hospitals?
Innovation, specific innovations, particularly. In this time we are in now, it's going to be the policy impacts that we have that will impact Medicaid. The HR 1 bill that was passed last year and now is gradually being implemented in a phased approach takes out $1 trillion. Even if you shuffle things around and you try to do specific things to mitigate these changes, $1 trillion is something that's going to drastically affect hospitals. Typically, 1 in 4 children in a state are covered. In some states, it's up to 1 in 3, and about half of admissions are covered by Medicaid. While a lot of the Medicaid cuts are focused on adults, they do and will have an impact on children.
From my purview, working with organizations to be able to help them articulate what those impacts are is incredibly useful as those organizations are thinking about how do they work through mitigation efforts, how do they work with other community partners to think about how they potentially blunt the impact of some of these funding changes.
I honestly think that's one of the best take-homes we had from the panel was the work that children's hospitals are doing in their local state and community around educating their lawmakers about the impacts of this. And it was interesting because all healthcare is local, but as they educated them, there was a lot of information these lawmakers had not realized. One of the panelists talked about how they have trained their entire leadership team to be able to do outreach with their local lawmakers and also to support lawmakers that have policies that are child first. They're getting actively involved in their local politics to support politicians that are supporting child health policies. It's becoming more and more important than ever as it impacts directly children's health.
That's amazing. Such incredible work. If you could leave pediatric leaders with just one piece of advice as they plan for the future, what would that be?
I am a pediatrician and I've been in the field for nearly 30 years. In my lifetime, I've never seen such a challenging landscape as is today for pediatric health. There are multiple headwinds when we think of the economic, when we think of the rising chronic disease and the health issues of children, when we think of the supply and the diminishing access in many areas of our country, when we think of the inequities, and when we think of what's coming down the pipeline. Recognizing that many of our children's health leaders, our children's health providers, our nurses at the bedside are overwhelmed and exhausted and do need to take care of themselves. They need support. and they need to be able to figure out ways to support them. We talk about reducing burnout for children's hospital providers. They talked about this on the panel too. It's not about just talking about, hey, you need to do meditation. It's really not a problem that the provider has to do more relaxation techniques. The problem is the system itself that's causing the burnout. Working on the system to be able to be a supportive, safe environment for all of those working at the hospital is critically important to be able to deliver care in an environment where things are rapidly changing in ways that are going to make it more difficult to provide care for children. When we talk to children's hospitals, they're less inclined to do things like, let's have a bagel breakfast to celebrate doctors. They'll do them, but that's not going to mitigate burnout, and really work at the hurdles and challenges that providers are feeling on the front line. The same goes with administrators with the decision fatigue, like working on how do you make your work more efficient, more focused, more actionable, and less stressful.
Amazing. So well said. Maddie, thank you so much for joining me today. Always a pleasure to have you on the podcast.
Great. Thank you. My pleasure.
Thanks for listening to this episode of Edge Perspectives, a podcast from Vizient. If you have questions or ideas for future episodes, please reach out to us using the email address in the show notes.